Honorable Minister of Ayush, Government of India, Officer in Charge, SEARO, WHO, Excellencies, Ambassadors, Secretary West, MEA, Secretary Ayush, and other senior officials of the Government of India, esteemed colleagues from WHO headquarters, GTMC, Jamnagar, regional and country offices. I extend a very warm welcome to all of you to this precursor program for the WHO meeting, the global summit that will be held in Delhi in December. We are all aware that when the curtain is raised on the global summit, the spotlight will focus on the important but often under-recognized contribution that traditional medicine is making to the world. At this juncture, I would like to draw your attention to the larger picture in which the World Health Organization has sought to achieve health for all as its goal for the past 75 years. Not health for some, not health for many, but health for all. This does not mean health in a physical sense. It also means well-being. To achieve this goal, the Alma Ata Declaration of 1978 makes two very important declarations. First, that primary health care is essential for achieving health for all. And second, that primary health care must be based on scientific and socially acceptable standards, including traditional medicine. Thus, safe and effective traditional medicine has a definite and significant role in achieving our core objective. WHO is committed to developing the scientific basis for traditional medicine sector and to support its safe and effective use in all member countries. For centuries, traditional indigenous medicine and, importantly, ancestral knowledge has been an integral source for health in households and communities, and it continues to form a significant part of healthcare in many regions. 170 out of WHO's 194 member states report on the use of herbal medicines, acupuncture, yoga, indigenous therapies, and other forms of traditional medicine. Many countries now recognize that traditional medicine is a valuable source of healthcare and have taken steps to integrate practices, products, and practitioners into their national systems. Today, traditional medicine has become a global phenomenon. The demand is growing, with patients seeking more holistic and personalized healthcare. For millions, especially those living in remote rural areas, it continues to be the first choice for health and well-being, offering care that is culturally acceptable, available, and affordable. And I, Excellencies, have personally witnessed this when I was posted in the districts of this country. WHO's work on traditional medicine responds to requests from countries for robust evidence and data to inform policies and practice, global standards and regulations to ensure safety, quality, and equitable access. The 2018 Declaration of Astana, which many of you would be familiar with, 40 years after the historic Alma Ata meeting, reiterates the need to include traditional medicine, knowledge, and technologies in the delivery of primary health care. This has paved the way for the G20 and BRICS countries to amplify the call for greater attention and recognition of the vital role of traditional medicine towards health and well-being. So the momentum, Excellencies, is growing. I'm aware that almost all countries of our Southeast Asia region have developed and implemented a national policy for traditional medicine. WHO has developed traditional medicine modules of the International Classification of Diseases, ICD-11, covering traditional Chinese, Korean, Japanese, and Indian medicine that includes Ayurveda, Siddha, and Unani systems. Using the ICD-11 data standards will support robust international data collection and analysis to inform and improve policies and practice. The recent adoption of the Global Strategy for Traditional Medicine at the World Health Assembly in Geneva last year underlines the case for investing in traditional medicine as a cornerstone of health and well-being. Next month, the WHO Global Summit on Traditional Medicine will take this momentum forward. GTMC Jamnagar reminds me of the wonder which is shaping up at Jamnagar, and which in turn is transforming Jamnagar gradually but surely into a model city, a project worth looking forward to. GTMC on the one hand is creating real-world benchmarks, and on the other is also making a giant leap into the virtual space with Traditional Medicine Global Library, a virtual repository of the global knowledge and the much-needed evidence bank of traditional medicine to be launched in the summit. We look forward to supporting your political leadership in fast-tracking this agenda, delivering healthcare that is accessible, affordable, comprehensive, and quality assured. Let us act on our historic commitments and accelerate our work together to achieve a person-centered, holistic approach to health and well-being for a biodiverse planet and a healthier, more equitable and sustainable future for all. On behalf of WHO Director General Dr. Tedros, I once again thank you and extend a very warm welcome to all of you.